Hi, my name's Navina, and in this video, Medapply's co-directors Shrey and Catherine will be going through some common question types to expect in your MMI. These include acting MMIs, medical ethics questions, work experience and volunteering questions, why medicine or dentistry questions, and finally, demonstrating characteristics questions.
First of all, we have the MMI acting stations, and they involve you playing a hypothetical scenario, and you're usually required to show empathy and how you would react in an emotive situation. Really think in depth about your role in the scenario. Usually, you're going to be a medical or dental student or a young doctor or dentist, so don't work outside of that remit. Use your body language and communicate effectively. Make sure, if possible, over Zoom, it's going to be a bit more difficult, but maintain a good posture, maintain eye contact to ensure that you're listening to the other person. Of course, again, over Zoom, that's difficult. Speak calmly and clearly, and don't have over the top suggestions or say things that you might not be sure about. One of the biggest keys to these question types is to take responsibility for any actions that the scenario tells you that you have committed in the or may have taken in the hypothetical scenario. Don't try and claim that you didn't do something that the scenario tells you that you have done. Take responsibility for the actions in the scenario.
So now we come on to ethics questions. These are common in MMI and in panel interviews. So these questions test your decision-making skills and your ability to make an informed choice on the spot, and obviously your understanding of the 4 pillars of medical ethics. With these questions, you should always be prepared to consider an alternative argument and explain your reasoning behind every suggestion that you make as a part of forming a balanced argument. Before you go into the interview, you should already know the 4 pillars of medical ethics. These are justice, autonomy, beneficence, and non-maleficence. It's imperative that you know how to integrate these 4 concepts in your answers. So make sure not to consider one principle of medical ethics in isolation, but integrate them when you're considering things. Make sure to keep up to date with key ethical cases and fiercely debated topics from the news. These will affect the future practice of healthcare staff, and so you should be aware of them.
And the next question that we'd like to talk about is why medicine or dentistry, or why do you want to be a doctor or a dentist? This is possibly the most common question type. And so it's really going to test your reasons for choosing this career path and whether or not you've looked into this career path in enough depth. For this question, try and think of what you want to say beforehand. Plan it before you go into your interview. Try to think of the main 3 ideas that influence your choice to study medicine or dentistry. In this question, always mention your work experience or your personal experiences if possible, and show how this has helped you understand the role of a doctor or dentist and how it has shaped your motivation. Now, for this question, we have a specialized Medapply formula for you to remember during your interview. This is the acronym MED: motivation, explanation, demonstration. First of all, state your motivation. This is your reason to study medicine or dentistry. Delve into this reason a little more and explain it. Within this, demonstrate what you did or what you saw that inspired your motivation, and try and round it all off with a bit of reflection or substantial reflection if you can.
So now we come on to work experience and volunteering. So in 2020, you will likely have to draw on your experiences from virtual volunteering or virtual work experience platforms. Although this is very different to previous years, you still will be learning about the role of a doctor and asking yourself the same questions, albeit having a different source or type of work experience. Whenever you talk about work experience or volunteering, make sure to explain what you've learned from your experience to demonstrate your ability to reflect. Here are some questions that you can think about when reflecting. So how has your work experience changed your perspective of medicine or dentistry? What did you learn that was maybe surprising? And what did you learn that illustrates the good and the bad aspects of the career? It's important to recognize that medical and dental practice is never perfect. There's always room for improvement in terms of the way that people handle patient to doctor or dentist experiences, and also in terms of how the job actually presents itself. There are various challenges in either role. It's important that you reflect on all of this and think about how this can be applied later on in your own practice.
The next question type we'd like to look at is demonstrating a characteristic. So the interviewer might ask you, tell me how you've demonstrated so-and-so, which is a useful quality for a doctor or dentist to have. So in these questions, again, the overarching theme here is reflection. So it's really important to reflect on your past experiences and be critical of your own actions. Talk about the situation in which you demonstrated the skill, describe the event, talk about how you behaved. The impact of your actions here is going to be really important because it can help to show how the thing that you're talking about demonstrates that characteristic. The best way to make it obvious to the interviewer is to be really explicit about this. You can talk about your experience and then say, this shows the given characteristic, or I demonstrated so-and-so skill in this event by doing this. Mention why it's important to have this skill as a doctor or a dentist. What situations might require this skill in future? Make sure to look at the bigger picture as well. So in this section, we've focused on a few different question types, but the techniques that we've taught you here can actually be applied to a lot of the different questions, most questions that you might come across in medical and dental school interviews.